Hello dear parents, today we will talk about febrile seizures. So what exactly are these febrile seizures? Whenever the child is having a fever, the child may have a seizure activity, and these are most common in between 6 months to 6 years of age. So I know this is a terrifying experience for any parent or caregiver. So let us know how to recognize and how to deal when the child is having a seizure. Whenever the child is having a fever and the child is having jerky body movements, or the child stiffens his body and does not respond to your voice, along with uprolling of eyes or the staring look, then you have to have a doubt of the child having a seizure. So immediately, how to deal with it? You have to move the child to a safer place and remove any sharp objects or furniture around him so that it will not hurt the child. And you have to loosen any tight clothing around his neck, because the child may not breathe during a seizure activity. And what are don'ts? What you should not do? You should not put anything in the hands, because the child may harm himself because of the jerky movements. And do not try to put anything into the mouth, because the child may choke. And do not try to restrain the child's body movements also. And when to rush to your hospital? When usually the seizure activity subsides in few minutes, and during the seizure activity, prefer the child to keep in a recovery position, that is lateral position, preferably left lateral position. So when the seizure activity is prolonging for more than 10 to 15 minutes, or when the child is turning blue, just look at his lips and extremities. If the child is turning blue, you have to immediately rush to the hospital. And how to prevent these seizures? One thing is that the grade of temperature will not decide the incidence of or occurrence of the seizure. So even a low temperature can cause a seizure activity in child. So whenever you observe fever in a child, immediately give antipyretics and do sponging to the upper part of the body, especially forehead, head, underarms and under neck. This sponging of body may not totally prevent the seizure, but it can definitely decrease the incidence of having a seizure. So please parents, don't panic, and know how to help your child whenever the child is having a seizure activity. Thank you.